So if you don't already have the link, you can just search Pebble Pad on Google. Pebble Pad, log in, and you'll be logging in through your organization, any BDN. So log in, select any BDN, and then log in with your email and password. This will take you to your Pebble Pad account. And your Pebble Pad account, if you click on this sort of burger menu at the top and go to your resources, these are all the resources. You can just ignore these witness assessment ones. The only one you need to focus on is the ROC, dental sedation nurse, in here. You'll find if you click on WB workbooks, it's here. So that's the only one you need to click on. Again, if you click on these 4 squares here, you can access it from here as well. ROC, dental sedation nursing. So you can access it from lots of different places. If you click on Pebble Pad, it takes you back to home. So burger menu, resource store, and then dental sedation nursing. This is your online record of competence. So it's the same as the paper one. It's broken down into your introduction, tracking documents, your PCAS. So these are the assessment sheets that are completed for each intravenous sedation, inhalation sedation case, as well as notes for guidance. Case studies, notes for guidance, and then the 2 case studies. Docs, so these are directly observed clinical skills assessment sheets, along with notes for guidance and supplementary outcomes. These are things like uploading a certificate of your basic life support, immediate life support training, or carrying out a short audit. There's quite a few things in there, so we'll go through that. But anyway, I would read through the introduction and just familiarize yourself with all of this. And then when you start completing your cases, click on PCAS for intravenous sedation treatment, intravenous sedation recovery, and for inhalation sedation, there's just 1 sheet. So for each, let's say you have a patient in for intravenous sedation treatment, you click on that, and then go PCAS 1. This will be your first one. This won't say anything on here, I just delete this. So when you log in, it will say witness assessment, this has not been evidenced, and then you'll have the sheet itself. So you just type in your name, select the date that you're carrying out the sedation, and just confirm patient age. So these can be just copied up from the patient notes afterwards. You don't have to do this while you've got the patient in, but if you've got time while they're being sedated, if you're not the assistant nurse, then you can, or you can just copy them up afterwards. Patient age 33, let's say patient gender male. Source of patient referral, this would be from dentist or from hospital. Relevant medical history, you might put patient takes warfarin, or any relevant medical history. Relevant dental history, that could be things like poor attender, or lots of restorations, just something simple. Geosedation history, previous sedation with midazolam, for example. Is the consent form signed? Yes. Pre-sedation observations, so these will be in your patient notes anyway, but just write these in. So heart rate, looking at usually 60 beats per minute, that sort of rate, but you have that anyway from your sedation records. Oxygen saturation, 98%, to put the units here as well. Blood pressure, 120 over 18 millimeters of mercury will be standard, or whatever you've recorded. Respiratory rate, this is the rate of respiration, so number of breaths per minute. I would just put standard as 12 if they're sort of breathing quickly, and it'll be more than 12. If they are very slow breathing, then it might be less than 12, and you can record that. Height, if recorded, in centimeters. Weight, if recorded, in kilograms. BMI, if recorded. I would tend to just put if it's over or under 30, because that will be your cutoff point for classifying them in a different ASA grade. as we get onto sedation scoring. From your notes before, you'll see it explains about sedation scoring in notes for guidance. Let's have a quick look. So your sedation scoring you see here. So just put a number. So eyes closed responds promptly. That's a nice one, 3. Then you can rate your level of sedation here. So go back to that. See, it's still saved. So sedation scoring, let's put a 3. Assessment of operating conditions, good. ASA rating 1, which means they're a healthy patient, fit and healthy. 2 would be someone with, say, mild systemic disease, or someone who smokes, but well managed. And then you go on to sedation techniques. So the technique you use, the access sites, that's like the dorsum of the hand or the antecubital fossa. Topical anesthetic used on the hand or arm. Drug used, always be midazolam. Amount of drugs used in milligrams. Batch number, which will be on the vial of midazolam itself, and the expiry date. In treatment monitoring, you put an oxygen saturation high, 98, oxygen saturation low, say if it dropped. Heart rate average, blood pressure. You've taken the right treatment. Any difficulties incurred? No. Straightforward sedation. And that's it, that's all you complete. And the rest is for us to complete. So that's saved. And in terms of your witness signing it, they need to rate whether you were competent or not.